Hi everyone, Allan Knight here on a beautiful Thursday morning, ready to do another spontaneous podcast. And today we have a very special guest with me that we're going to debate a topic. We're not even sure what the topic is, but that's okay. We'll figure it out. Her name is Tangee Moscoso. Tangee, welcome.
Hi, how are you?
How are you? Tell everybody where you live and where you're from and a little bit about yourself in 60 seconds.
60 seconds. So I'm Tangee Moscoso. I am a nurse practitioner. I practice in the state of Illinois and some in Ohio. I'm actually trying to expand to Hawaii. I have my own practice. My specialty is holistic psychiatry, holistic spiritual psychiatry is what I call it. I treat my specialty within that is trauma. So I am very holistic in the approach to that. I try to aim and help patients get off their medicines or at least minimize the amount of medications that they're on. And then also in general, I do some coaching, and that is just for wellness, health, helping people cope with medical issues, helping people just find their happy, whatever that may be for them, because I think it's different for everybody. So yeah, that's a little bit about me.
That's fantastic. You're obviously doing a lot of great work. And the reason we decided to do a little podcast together is there's certainly overlap in what we do, although it takes a different form. As people know, I'm a former Zen monk turned communication and inner fitness coach. And you and I were chatting before about the fact at the end of the day, most people talk about the fact, how do we become free? How do we become happy living in sometimes a confusing, chaotic world? So we're going to go with this topic and see where it takes us. Now, I want to start, if you don't mind, with I'm very interested in what you said about trauma. Obviously, trauma, and all of us experience different levels of trauma. The work that you have done, has it been with more extreme trauma or the full range of trauma?
I think it's been a full range of trauma. I think most people that have come to me oftentimes have been diagnosed with various other illnesses. And underneath all that is really trauma.
Have you found that in your experience that people who do experience trauma and work with you, especially, find it's a blessing in disguise, and if they use it in a productive, creative way, they turn around their life even more so than they would if they didn't have the trauma?
Well, that is my journey with them, to help them see that.
Yeah.
That is exactly what I aim to help them see, because it's different for everybody, right? So you are whatever the meaning you give it. And so I try to go there with them, and sometimes they just want to focus on medications, right? Because it's a bit easier, and we just treat the symptoms. But underneath it all, after my first evaluation, what I usually tell them, and I go over the whole holistic approach that I use.
Yeah.
Suggest a treatment plan, and part of that is, digging into the root of the real issue. Yes, you're having this anxiety. Yes, you can't sleep. Yes, your mood is up, and whatever it may be for that person. But underneath that, there's a reason, right? There's a core reason why. So let's get to that.
Mm-hmm. Are you one that believes that in pretty well every situation we can abandon medication, or in some cases we need to use medication along with our alternative methods?
I think everybody's an individual. And so some people, trauma, if you've ever experienced it, and I can speak from my own self, I have experienced trauma. And again, everybody else has at some level, only they may not know it or call it that. But for me, I put myself in their shoes, realizing that it can be a very hard journey. When you actually remember, for some of us, like me, I never remembered my trauma. That's why I didn't know about it. I just, And so for some people, they don't remember it. For some people, they remember everything there is to know about it. So some people have a hard time engaging in therapy about the trauma, because it's just so scary to find out what could possibly be underneath the things they don't remember, right? And so they won't. And they just want some medicine to help them sleep and help them with their medicines. And the goal, again, with me is we are very holistic. And I don't just prescribe the medicine. We still talk about, well, I wonder what that's about. I help them question their own symptoms. sit with yourself. Sometimes they're more happy to do therapy with me than they are in engaging seeing a therapist because they might have had some issues with them or some whatever. So it just depends. Some people are ready for that non-medicine. I do believe our body has our ability to heal for sure. That is my aim, but it's not everybody the same, and that's okay.
That's a great answer because it shows that you're truly holistic and it's not a black and white generic answer for everyone. It's fantastic. Are you able, without getting too personal, and if I'm asking it too personal, just let me know, but are you able to give us or the audience an example of some form of trauma that you went through in your own life and how you managed it?
Well, I think trauma, when I think about it, when I really try to get to the root of it, it's more dealing with childhood trauma. Yes, we all have had some sort of trauma. Like there's obviously the people who have gone through, military, going into the military and then being at war per se. Like there's so many places they've been sent to. So that is obviously something that's happened above the age of 18. And that is obviously PTSD, right? And then they get treated. But I think there's underneath all that, I get more into the childhood traumas of people. The kinds, can be, I think I've experienced all of the above. At different levels.
And you were always able to pick yourself back up and learn from the experience and move on.
Well, no, because I was a child.
Oh, no, but I
Right?
mean, once you started dealing with it.
Well, that is the thing, is like the beautiful thing about us humans is that our body has the ability to heal. And like
Right.
I didn't remember a lot of my things. I knew some of it, right? But I didn't know. And I started digging once I actually started experiencing some symptoms when I was in a relationship. And I was like, okay, this is trauma. Like I knew, intellectually being a provider that I treat patients like this, that this is trauma symptoms. Like, why am I having trauma symptoms if I've never had trauma like that? And so that is where my journey began, actually being in a relationship like that.
Do you ever deal with dreams and lucid dreams as a healing mechanism? The reason I ask you is that in the last 6 months, I've had amazing lucid dreams, and 99% of them are really positive. And I'm kind of, about a week ago, I had 3 dreams which were I don't call it negative, but issues that I thought I had dealt with a long time ago,
Yeah.
resurfaced, and it blew me away that it was still there. So do you use dreaming as part of your solution therapies at all?
So I think that when patients ask me, I'm starting to have vivid dreams, my big thing that I treat when I'm addressing trauma is more the nightmares, because then we can, that is part of the trauma. And it
Yeah.
is not unpleasant, right? I mean, it is not pleasant. It keeps people from sleeping. Some of my patients don't want to sleep because they're so scared to have those nightmares. So in that regard, yeah. But then when it comes to the vivid dreaming, like you're saying, having lucid dreams, I think that definitely our subconscious is definitely trying to help us, right? It's again, the body trying to heal itself. And it's, if you meditate, and then you said, your history, your background is being a monk, and that's beautiful. I encourage meditation to all my patients. That's actually part of my treatment plan with them. Yes.
I talked to you a little bit last week when we were chatting about something that I was introduced to about a month ago, which I'm doing currently. It's called traumatic release exercises. And they show videos of animals in fight or flight that run away, and when they stop, they tremor and release the emotion, whereas the doctor says that most of us hold it in the psoas muscle. It kind of accumulates. And I've had 7 sessions in my house that I've done, and my legs start shaking just involuntarily, and it seems to have a certain release. Can you comment on this kind of thing? Is that really a valid, good way to release a hidden emotion, blocked emotion?
I think there's various ways, and I will never tell you that for every patient there is only one way of treating their traumas, right? Like I told you earlier. So if that is what's working for you, do it. Continue doing it. I say try everything that that we recommend, or that whatever provider you have that you trust. If I say feel it in your gut, if you feel like this is it. But what I want to add to that is our body remembers. Yes. So any type of body work therapy is beautiful because your body never forgets. We forget, especially as kids, because the experience was so traumatic, it tries to keep us safe,
Mm.
right? And so, of course, then there's that forgetting. It's easier that way. But it's a safety mechanism. But your body will always remember whatever happened. And so a lot of times body work can bring out, and again, people don't want to do it because then it brings back all the stuff, right? The stuff
Mhm.
that they thought they put away millions of years ago. I mean, I've had patients who are like in their 80s and just now working on trauma that they had when they were kids
Wow.
for the
Th-
first time.
This is such a fascinating discussion. We go on for hours. I know we're coming to the end, but I want to ask you a couple of last questions. One is, and we didn't know we are going to go down this road, but it's
Oh, awesome. Yeah.
kind of cool. Um, if the audience are sitting there, some people who just might be dealing with some trauma that's starting to surface, what is, if you were going to say one thing, I know that there's a lot of things you can say, but if you're going to choose one thing that will help them or support them or inspire them, what would that one thing be?
I think that it's so many things I could say. You're right. One thing, I don't know that I could say one thing, but I can tell you that once you know that everything and even the ugliness that happens to us, it's to make you better. And it sounds so counterintuitive. I get it. But it can make you so beautiful. Can really bring out the gifts inside that you may have never discovered. And I think that that is the journey to realize that you're not damaged or flawed or that why me, right? Because to be honest, a lot of people who go into, or have had trauma, they do become this whole victim mentality, like hate the world. How could this possibly have happened to me, right? And it's easy to go that route, but it's a choice. So anything is a choice.
You know, your answer is so good. I relate to it because I told you I was diagnosed with Parkinson's 5 years ago. And although, I'm managing it well and sometimes people wouldn't even notice, but I have used it. It's been the biggest blessing in the world because it's forced me, I've allowed it to force me to go much deeper into my soul, into my personal development, into my mental state. I've never been more free, never been more happy. I've never been more successful in every area in my life, and I mainly have gratitude. So if I heal it completely, great. If I don't, it's not going to define me. So what you said is very beautiful.
Thank you. No, yes, I love your journey because that is exactly it.
Uh,
Welcome.
Tell us who is your ideal client? How would you do? I mean, how would you describe your ideal client?
Obviously, when you're dealing with trauma, I try to deal more with adults only because you have to want to work on this stuff. When you're a child, you don't even know that you're having trauma half of the time, right? They think it's normal because that's all they know. So it's usually adults wanting to really get to the root of their issue and really understanding that it's a journey and they're willing and committed to themselves.
Mm-hmm.
My ideal patient.
Wonderful. And how do people get in touch with you?
Well, I have HMH, well, www.hmhwinc.com. That's my website. I have a Holistic Mental Health Wellness Inc. Page on Facebook. My phone number, 224-366-7537. There's lots of ways.
Tangee, are you good at receiving compliments?
Of course, that's the
So
way.
can I give you two?
Sure.
So number one is one of the best. You have a lot of wonderful qualities, but one thing that really stands out is you're a no nonsense, very direct, honest person that calls a spade a spade. That's number one. And you're the real meal deal. You get a chance in our profession to talk to a lot of people, and you get the sense that a lot of people are talking about health and well-being and motivation and all those wonderful things. But I really get the feeling that you've really walked the talk, and you've got a very global, holistic, very solid approach to your profession. So I'm just giving you an acknowledgement, my dear.
Thank you, and I welcome that completely. I appreciate our talks, and hopefully we can continue doing this.
I'd love to do it again. You're open to it?
Yes, of course.
Wonderful. Thanks. I hope everyone enjoyed that. We're going to call this All Things Trauma. See you soon.
Bye.